Hey everyone, Todd here, internalarchitect.com. In this video, we're going to kind of get back to some basics. We're going to kind of go back to little cancer 101, and we are going to talk about what a cancer doctor is called. Now, I'm sure some of you are like going, come on, Todd, we all know this. Well, this is kind of more geared towards those that are just maybe got the news or just kind of going through it and unsure of what it is that is happening or what they will experience. This kind of goes a little bit aside from what I normally talk about as far as helping the survivors, but I think helping new patients or people that are in the middle of it also, I think is really important too. This is back to a little bit of Cancer 101, and that's why I wanted to discuss what is a cancer doctor called. Well, a cancer doctor is called an oncologist, and they practice oncology, and that is the study of cancer. This is really the simple side of this, right? I'm going to go over 6 different types of oncologists that deal with the different sides of oncology. By the time this video is done, you'll have a better grasp of what it is that they do and why it's broken down. Now, the first one is a medical oncologist. Now, they treat cancer using chemotherapy and targeted therapy and immunotherapy and other medications also. They are the ones that kind of prescribe the first round and the first bit of your treatment. But they also work hand in hand with the second oncologist, and that is a surgical oncologist. Now, surgical oncologists uses surgery to remove tumors, and they help with performing biopsies. They are pretty critical in helping diagnose and stage your cancer and figure out where you're at and what kind of treatments you're going to be possibly needing moving forward. Now, the third one is a radiation oncologist. And now, a radiation oncologist treats cancer using radiation therapy. So if you have to have a tumor that needs radiation to be part of treatment, then you will see a radiation oncologist also. Now, these 3 can work hand in hand together in coming up with the type of therapy and treatment that you need moving forward. So they work a lot more hand in hand than kind of the rest of them, but the next 3 are also really important, and they all can work together depending on what kind of cancer you have. The fourth one is a gynecologic, I think I'm going to get that right, sorry ladies, gynecologic oncologist. Now, they treat gynecologic, I'm never going to get it right, cancers like uterine, ovarian, and cervical. So it's more of a female oncologist that helps with the feminine area of the body. So that's kind of a way to explain that. Sorry ladies, I completely apologize on that. The 5th one is a pediatric oncologist. Now, pediatric oncologist deals with children and children cancers. They will also deal with adult cancer patients if the cancer is very similar to what certain children deal with. So it all kind of depends, but mostly pediatric oncologists deal with kind of a touchy subject there, because none of us ever want to have to see a child go through cancer, because for those of us that have been through it and are survivors, that's just a real tough pill to swallow. So, and then the 6th one is the hematologist-oncologist. Now, they deal with diagnoses and treatments for blood cancers like leukemia, lymphoma, and myeloma. And they're just specialty oncologists for those fields in itself. So those are the 6 different oncologists and oncology people that really do everything in the cancer world. It's broken down from my understanding and my experience of talking to the different. For me, I had a hematologist. I also dealt with a medical oncologist and a surgical oncologist through my lymphoma, just having lymph nodes removed, having a liver biopsy done, and having ports placed also. Those were kind of the gist of the people that I dealt with through my lymphoma. So their job is to really explain the diagnosis and staging of your cancer, and they're going to help give you a better understanding of what it is that you might be up against. They should review all the different treatment options for you. There are a lot of different treatment options. There's a lot of very medical-based treatment options, which is Western medicine, and then there are some that aren't suggested, and that is through Eastern medicine and some other avenues there. As a new patient or potential patient, you should by all means take a look at those also. And then their other job is to help deal with symptom and side effect management. So if you're dealing with a lot of pain, or you're dealing with a lot of nausea, or whatever it is, they should be able to help you deal with those situations, those symptoms, those side effects that come along with, unfortunately, the chemotherapy and the radiation and even the surgical side of cancer. So yeah, so those are the 6 things, the 6 different types of oncologists and kind of what their job is to do. If you have any questions, hit me in the comment section below. There's always kind of some interesting things that I get private messaged about, and I try to answer them as best as I can. But yeah, hit me in the comment section below and give me a thumbs up and a like, and subscribe to the channel if you like what you're hearing. And please share. That's how I'm able to continue putting out some information and some content to help you all who are dealing with cancer, and someone that can really help you relate and make you feel a little bit more comfortable about what you are going through or what you have gone through and looking for that next stage. So again, I thank you so much for your energy and your time, and I will see you on the next video.